Okay, so I'm going to be performing a catheterization on a female client. So before I do anything, I'm going to check the doctor's orders. I'm going to make sure that I have the right size of catheter, the right type of catheter. I'm going to make sure that I have the right patient by checking the armband, name, and birth date. Okay, so then I'm going to wash my hands. Then I'm going to lower the blanket and expose the perineal area. So I'm going to palpate for distension. I'm going to ask about discomfort, any pain. I'm also going to check for allergies before I do anything. Then I'm going to put on clean gloves, perform pericare, center away towards, then dispose of the gloves and wash my hands. Okay, then I'm going to set up my catheter and my sterile gloves on the bed here. Then I'm going to open up my sterile field. So, away first. So anything below the table is now contaminated. So I have a 1-inch margin. I'm going to take out the pads. Okay, now keep that. Now I'm going to open up the catheter. And because these are sterile and this is sterile, I'm just going to place this inside. Oh, and I'm also going to put the garbage bag in between the client's legs just to dispose of things. Now I'm going to put on sterile gloves. Okay. So you start with your non-dominant hand, and you grab the inside of the cuff. Okay, and then you grab the inside of this cuff. Okay. So now, because I have sterile gloves on, I can take this out of its package because we want to keep everything sterile. Put this in the garbage. Put this back in here. Okay, so we're going to drape the patient. Okay, shiny side down. Now, ideally with a female patient, you want her to assist you by lifting up her bottom so that this will go underneath. And then you want to put the blue one on top, shiny side down. Okay. Now you place this onto your bottom pad because you want to keep it sterile. So now you would lubricate the tip of the catheter and you would insert the syringe into the port. Okay, we want everything stay sterile. Okay, now this has gotta stay like that. Okay, so now we want to sterilize the perineal area. So you spread the labia and you do one swipe center, one swipe away, and one swipe towards. Okay, now that's dirty. Then, so you want to get rid of all the extra materials because urine's going to be going into this container. Then you will insert the catheter, making sure that the labia don't close, because then you have to restart. Okay. So then you would fill the catheter to inflate the balloon, and you pull back to make sure that the balloon is inflated. Then push it forward just so that it's not sitting against anything, just to increase comfort. So then a little bit of urine is going to flow into this container, at which point you would want to connect the catheter to the outflow bag. And that is how you do a catheterization.